Hi, welcome back to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about treatment of a adolescent or teenage patient, the treatment of overcrowding without extractions. Leah presented at 11 and a half years of age in the permanent dentition after all of her baby teeth or deciduous teeth had fallen out. She presented with the underdevelopment of her upper jaw, particularly in the transverse or the width of the upper jaw. Leah also had a significant overcrowding in the upper arch with no space for the growth or eruption of her upper canine teeth. Leah's treatment started with the use of a hybrid type appliance in the upper arch or in the upper jaw. We use specifically the Easy Driver system, where we plan the placement of two very small temporary implants that are very carefully and safely placed about a centimetre behind the upper front teeth in the palate. These temporary implants serve initially as an anchor to carry out what we describe as skeletal expansion of the palate or upper jaw. This allows for an increase in the width and volume of the total amount of the upper jaw itself, which provides much more room for the alignment of all of the upper front teeth. We then fitted Leah's fixed braces or train track braces to start the commencement of the alignment of her teeth. As there was still inadequate space for the full alignment of her upper canine teeth, we then removed her expander and we replaced it with a special type of hybrid appliance called a distalizing device. You can see on the photographs that the distalizing device pushes back on her upper molar teeth, creating room for the growth or eruption of her upper permanent canine teeth. Once these teeth had started to grow or erupt, we then fitted the bracket to allow for connecting these teeth to the upper wire or the upper brace, and then they quickly erupted down into position. At that point, we fitted the lower fixed braces to allow us to align the bottom teeth and create the correct fit of the teeth or bite, known as the correct occlusion. And then once this was completed, we then removed Leah's braces, and now you can see that she has the optimum fit of her teeth and bite. This will allow for the maintenance of long-term dental health and function, in particular the health of both her teeth, her gum tissue and her jaw joints. And you can see there's been a significant improvement in the appearance of her teeth and smile, where her upper front teeth are now visible both when speaking and completely visible when smiling. And overall, there's been a significant improvement in her facial aesthetics. I'm often asked why we can treat some patients without the need for extractions. In this particular case, Leah's overcrowding was a result of the inadequate width or development in her upper jaw. The use of this advanced technology, the hybrid expander appliance, allows us to create or increase the growth and volume in the upper arch and in the palate. And this creates more space for first of all, the eruption and then the alignment of the unerupted canine teeth. In some other cases, it's not possible to increase the volume of the upper jaw in the same way, and therefore dental extractions are a more appropriate and safer way to create the correct alignment and fit of the upper teeth.